Emily is a 29-year-old mother of a 5-year-old boy who lives with her husband and son. She came to this practice for prenatal care during her pregnancy and routine gynecological care following that, but her last visit was almost 2 years ago. She was using Depo-Provera after the birth of her son, but stopped using it because she did not have health insurance. She has come to the office today because she missed her last period.
Hi, Emily. It's good to see you. How are you doing? Your son, how's he doing? Daniel, right?
Yeah, he's great. Just started kindergarten.
Oh, that's great. Good to hear. So looking through your chart, I was looking back and I noticed you haven't been here for quite a while.
Well, my job went to part-time last year, so I didn't have insurance, but now I'm back to full-time.
Okay, great. So you have your job, you have health insurance. So what brings you in today?
I missed my period this month. It's been irregular before. When I was on the shot, I stopped getting it completely.
Right, that can happen on the depot. That's pretty common. But you're off the depot now, right? And looking back to see that your period was 6 weeks ago, have you been doing anything to avoid getting pregnant?
Well, we use condoms sometimes, but my husband usually just pulls out.
Oh, okay. So have you taken a test at home yet?
No, not yet.
Well, when you came in, we noticed on your chart that your period was late. So when we collected your urine, we did a pregnancy test, and it's positive. So it looks like Daniel's going to have a little brother or sister. So before you leave, we'll get you set up for prenatal care, and we'll be seeing a lot more of you.
Okay.
So I know it's a surprise. How are you feeling about being pregnant?
We have talked about having another child, and I would like Daniel to have a brother or sister someday, but this isn't really a good time for us.
I see. Okay, so you do have other options. Do you want to hear about those?
Sure.
So one thing we could do is set you up for the prenatal care. We would do just like what we did with Daniel. We make sure you have a healthy pregnancy. Another thing we can do, if you decide to continue the pregnancy, is we could set you up to talk with someone about adoption, and then you could give up the baby for adoption.
I don't think I could go through the pregnancy and then do an adoption.
Oh, okay. So another thing you could do, if you decide to terminate the pregnancy, there's 2 ways to go since you're very early. One would be a brief surgical procedure, and the other way is to take pills.
I'm not sure. Would I have to go to a clinic? Would I need to miss a lot of work?
No. So there's someone here in my practice who could take care of you. And what you do, the first one is a brief surgical procedure. We do that in the office. You'll be a little bit tired that day. You'll need to stay home. But you could go back to work the next day.
What about the abortion pill?
So that one, the way that works is you take one here in the office, and then you take some more pills at home. That makes you have cramps and bleeding, and you expel the pregnancy like a miscarriage. But that takes some more time, and given that you're working and you're taking care of Daniel, I don't recommend that. So you think you might want to have an abortion?
Well, I do want to have another child someday, but I'm not sure this is a good time. My job's still not secure, and I really want to be there for Daniel while he's getting used to being in school. I need to think about it and talk to my husband.
Okay, so why don't you make another appointment for a few days? Go home, talk to your husband about it. If you have any questions between now and then, you can give us a call.